So, what happens when a totally routine scan finds something unexpected? It's a moment that can cause a ton of anxiety for anyone, but it's also where medicine gets really, really interesting. Today, we're going to dive into how doctors decide between taking immediate action and just waiting and watching. And we're going to do it all by looking at one tiny 5 millimeter polyp.
Okay, so just picture this. You're at a routine checkup, feeling totally fine. The doctor finds something small, completely out of the blue, and you literally have zero symptoms. Suddenly, what was a simple scan becomes this huge source of worry. So what actually happens next?
To really get to the bottom of this, we're going to follow a real-world case study. This is based on the exact guidelines doctors use every day. We're going to trace one patient's journey to see precisely how these critical decisions get made.
All right, let's meet our patient. She's 47, and this is the key part. She feels perfectly fine. She's totally asymptomatic. This 5 millimeter polyp in her gallbladder, it was found completely by accident during a routine scan. And it's worth noting there are no gallstones, which kind of simplifies the whole picture. This profile is basically the textbook definition of an incidental finding. So, just like that, we're at a crossroads. There's a finding, and now a choice has to be made. This is the central question, not just for the patient, but for her doctor, too. Do you act right away, or do you wait? Let's take a look at the options on the table.
Okay, so medically speaking, there are a bunch of different paths you could take here. They range from a pretty minor test all the way up to major surgery. You've got aspiration, simple observation, and then this whole scale of surgical options. So when you're faced with this menu of choices, how on earth does a doctor decide?
All right, let's start with option one, aspiration. This is basically where a needle is used to draw some bile out of the gallbladder. The whole point is to examine the cells under a microscope to see if there's anything unusual. I mean, it sounds like a pretty logical first step, right? Just grab a sample and see what you're dealing with.
But, and this is interesting, it turns out that's actually the wrong move. The medical guidelines are super clear about this. Bile aspiration, and I'm quoting here, does not have a role when you're investigating gallbladder polyps. So, boom, we can take option one right off the table. It's just not a useful test in this situation.
So, if a simple test is out, what about going to the other extreme? Surgery. The main option here is something called a cholecystectomy. That's just the fancy term for completely removing the gallbladder. It's obviously a much, much more aggressive approach than just watching and waiting.
But is that the right call in this situation? For our patient, the answer is a hard no. For a tiny 5 millimeter polyp with zero symptoms, jumping straight to surgery is considered way too aggressive. These big operations are really reserved for cases where there's a strong reason to suspect gallbladder cancer.
So, okay, if aspiration is a no-go and immediate surgery is way too much, what's left? Well, the official guideline is crystal clear. The correct path is observation, using repeat ultrasounds to simply keep an eye on things and see if the polyp changes size over time.
And this really gets to the heart of it. The best thing to do here is not to intervene, but to watch. This approach is called active surveillance or watchful waiting, and it's the standard of care because it avoids all the risks of an unnecessary surgery while still being totally proactive.
So you might be wondering, why is wait and see the right call for our patient, but maybe not for someone else? Well, the entire decision really hangs on one single critical factor: its size. So what's the magic number we're talking about?
It all boils down to this: 1 centimeter. That's it. This one single measurement is the key threshold that guides the entire treatment strategy.
And this brings us to what's basically the golden rule here, the 1 centimeter rule. If a polyp is smaller than 1 centimeter, like our patient's, which is only half a centimeter, the standard approach is to monitor it with follow-up ultrasounds. It's simple, it's effective, and it's backed by a ton of evidence.
So that naturally brings up the next big question, right? If we're just watching the small ones, when does the situation change? At what point does the scale tip from let's wait and see to, okay, it's time to consider surgery? And this chart, it lays out the whole decision-making process perfectly. On the left side, if the polyp is under 1 centimeter, the protocol is observation. But on the right, if it's over 1 centimeter, that's when you start seriously considering surgery. They're two totally distinct paths, and that single measurement is the fork in the road.
And just to give you some context on that most extreme option we saw earlier, radical surgery, that's reserved for really serious cases. We're talking about confirmed cancer that has started to invade the outer lining of the gallbladder. This really shows why a careful, size-based approach is so important. It helps prevent these huge interventions unless they are absolutely 100% necessary.
So what's the big takeaway here? What's the bottom line? In an age of high-tech procedures and quick fixes, sometimes the most advanced and powerful tool we have in medicine is just patience. For a small, incidental finding like this one, careful observation isn't doing nothing. It's an active, powerful, and evidence-based strategy. You know, this whole case really shines a light on a bigger shift happening in medicine, and it leaves us with a final question to think about. In this era of always wanting to take instant action, when is doing nothing actually the most powerful medical decision we can make?